Alright, so we have learned about physiology of breeding. We've learned how to breed. Now we gotta take care of the pregnant mare and successfully deliver the foal. If I can make that little box go away, we'd be doing good. Stop. Okay. Nutrition is very important for a pregnant mare, but more on that during the nutrition chapter. Brood mares do not typically need shoes, but if your mare has shoes, they should be removed before the baby is born. Parasite control is important for the protection of both mare and foal. It can be affected by deworming and general cleanliness and sanitation. Vaccination programs should include rhinopneumonitis at the 3rd, 5th, 7th, and 9th months of pregnancy, tetanus, equine encephalitis, and influenza 4 weeks prior to foaling. Additionally, vaccinations may include strangles, rabies, anthrax, and Potomac horse fever. The foal has to obtain antibodies against infection from the colostrum, which is the first milk produced by the mare. The best opportunity to absorb antibodies during the first 24 hours. Care at foaling time. In the final months of pregnancy, from the 10th and 11th, the mare finally begins to take on the enlarged characteristics of pregnancy. The mammary glands also begin to develop. The pituitary hormone prolactin stimulates the udder to produce milk. If udders fail to form, this may be the sign of some hormone inadequacies as a result of endophyte poisoning from fescue grass. Endophyte poisoning occurs from the ingestion of infected seed heads of fescue grass, which blocks the action of prolactin. Several days prior to birth, the mare's tail head, croup, perineal area between the rectum and the genitals become relaxed from the hormone relaxin. Pronounced effect of relaxin varies by number of pregnancies. Signs of impending parturition. Large pendulous abdomen and foal changes position. It drops. Udder enlargement, change in shape, and increase in calcium concentration thanks to prolactin. Waxing teats, dripping milk dries and hardens on the teats, giving them a waxy appearance 2 weeks before foaling. Relaxation of the tail head and perineal area thanks to relaxin 1 to 2 months before foaling. Enlarged abdominal milk veins 2 months to 2 weeks before foaling. Loss of or depressed appetite does not occur in all mares, but occurs in last month of gestation. Change in behavior, herd separation, pressing hindquarters against the wall, etc., 2 to 4 weeks before foaling. Equipment needed for foaling. 4 to 5 ounces of an iodine solution in a sterile jar. Tail bandages or 3-inch gauze bandages. Roll of sterile cotton. Packages of gauze squares. Adhesive tape. 1 pint providone iodine compound. 1 pint providone iodine compound. 6 to 8 clean towels. Enema tube, soap and lubricant. A seamless pail. Large animal thermometer. So the next are the stages of labor and parturition. Stage 1. Uterus begins contractions. Foal moves into birthing position. Cervix relaxes. Signs of stage 1 include restlessness, tail switching, pacing, and sweating over neck, chest, and flanks. Preparing for stage 1. Clean the perineal area Bandage the tail so it is out of the way, and clean and disinfect the foal's stall. If a mare has had a Kaslik operation, a suture to close her vulva to prevent infection from her sucking things in, it should be removed now. Stage 1 ends when the allantois or fetal membranes are pushed through the cervix by the advancing fetus and rupture, releasing amniotic fluid, aka her water breaks. Stage 2. Intense labor contractions that push the foal through the birth canal. Lasts no longer than 30 minutes. Little to do to slow down or correct problems at this point. Fetus is enveloped in a white, filmy membrane known as the amniotic membrane. The placenta should not yet be visible at this point. Foal should be positioned on its stomach, positioned upright in the birth canal, with its 4 feet slightly displaced, one before the other, and with the muzzle resting on top of the knees. The bottom of the feet should be facing toward the mare's hocks. The curving of the foal toward the hocks helps move the shoulders and hip through the mare's pelvis. Like so. As the caption reads, normal position of a foal during foaling. The forelegs are extended and the head and neck rest on the forelegs. The hind legs are extended backwards as the body passes outward. The foal's feet should appear within 15 minutes of appearance of the fetal fluid and membranes. If a foot should not reveal itself, one should make an attempt to reach in and retrieve it or determine the problem. If a mare has been pushing for 45 minutes and no sign of a foal is seen, intervention is needed. This may be a sign of dystocia, which is a difficult birth, can be caused by any number of reasons: mare exhaustion, foal too big, any deviation in the front legs of the foal or position of the head, twins, breech, meaning tail first, or foal being upside down. These are different forms of breech position. Obviously, tail first, but you can also have upside down and any other combination or contortions of the foal's body other than the normal position. The placenta will detach from the uterine wall within an hour of the start of stage 2, whether the foal is born or not. If the foal has not been born before the placenta detaches, it will lose its oxygen supply and die. Once the foal is born, it may have a blue tongue and nasal mucus. Care should be taken to remove the fetal membranes from the foal's head so breathing can begin. The umbilical cord should separate on its own. Once that happens, treat the stump with iodine. If it bleeds, tie it off with sterile tape or string. Stage 3. This is complete when the placenta and fetal membranes are expelled. It should be tied so it does not tear. All the membranes are passed 5 to 45 minutes after the foal's birth. If not passed after 2 hours, they should be considered retained and a vet should be called. The placenta should be released from the uterus naturally. Retained placenta in the uterus can cause metritis, an inflammation of the uterus, which can result in laminitis or even death. Signs of metritis can develop 48 hours after birth of foal. The placenta should be inspected to make sure there are not tears or missing pieces. It is normal for there to be a dark brown body of tissue called the hippomane floating among the membranes. This is the placenta with its different parts labeled: the pregnant horn, the body of the uterus, the cervical star, the umbilical cord, and the non-pregnant horn. Postpartum. Involution is the process after the membranes have been properly expelled, when the uterus will return to its non-pregnant size in 10 days. So obviously, postpartum means after birth. Defecation may be painful for mares following birth. Bran, beet pulp, more salt, or other laxative type feeds may loosen the stool and make defecation less painful. Lactating mare's energy requirements are double normal maintenance levels during the first 3 months. She also needs larger amounts of concentrates and high-quality hay. Eosia, a dark brown, odorless fluid, may be seen on the vulva. but a foul-smelling discharge signals a uterine infection and requires vet attention. Mares over the age of 15 may run the risk of internal bleeding caused by a rupture of the middle uterine artery. Symptoms include colic, pawing, anxiousness, and profuse sweating. Mares with this condition are often unaware of surroundings and of her foal and should be removed from the stall. Rebreeding. Foal heat occurs at 6 to 12 days postpartum, and they'll come back into heat as part of the uterine involution process. These mares are still very susceptible to infections and run only a 40% chance of successful conception. Silent heat. Some remain in standing estrus for longer periods after ovulation, and some ovulate without showing any external signs of estrus. Common cause is the mare's concern for their foal on the ground. Older mares with a greater number of past pregnancies may take a longer time to involate. Prolactin. The hormone stimulating lactation may inhibit the production of estrogen necessary for ovarian activity. So there you go. Care of pregnant mare and the foaling process.